Hey there, fellow YouTube enthusiasts. Today, we're diving into a topic that's both fascinating and a little bit terrifying: the rise of flesh-eating bacteria in the United States. Now, I know what you're thinking: flesh-eating bacteria? That sounds like something out of a horror movie. And you're not wrong, but this isn't just a Hollywood scare tactic. It's a very real and increasingly common issue that we need to understand and address. So, let's get started and explore what's going on with Vibrio vulnificus, the so-called flesh-eating bacteria. First things first, what is Vibrio vulnificus? Well, it's a type of bacteria that can cause a serious infection called vibriosis. Now, you might be wondering, what's so special about this bacteria? Well, let me tell you, Vibrio vulnificus is a real game changer. It's called flesh-eating because it can literally eat away at the flesh around a wound, leading to some pretty severe and potentially fatal consequences. But don't worry, it's not just a Hollywood horror. It's a very real and very serious issue. Now, you might be thinking, how does this bacteria even get into people's bodies? Well, it's all about the water. Vibrio vulnificus is commonly found in certain coastal waters, and its presence increases as the water gets warmer. So, if you're swimming in the ocean or near brackish water, there's a chance you could be exposed to this bacteria. But it's not just about swimming. It can also be contracted through eating raw or undercooked seafood, particularly oysters. So, if you're a seafood lover, you might want to think twice before digging into that raw oyster. Now, let's talk about the symptoms. Vibriosis can strike quickly, usually within 24 hours of exposure. Common symptoms include fever and chills, a red, warm, or swollen patch of skin or rash that spreads quickly and causes pain, fluid-filled blisters, and skin discoloration, nausea, vomiting, and diarrhea. But the most concerning symptoms are the ones that affect your blood pressure and mental state. Low blood pressure can lead to weakness, dizziness, fatigue, and fainting, while confusion or altered mental state can be a sign of something more serious. And let's not forget the rapid heartbeat, which can be a sign of sepsis, a potentially fatal condition. Now, you might be thinking, how can I protect myself from this flesh-eating bacteria? Well, it's all about taking some simple precautions. When swimming, avoid entering salt water or brackish water if you have any open wounds. Cover any open wounds with a waterproof bandage if you're planning to come into contact with coastal waters or raw seafood. And if you're at increased risk, such as people with weakened immune systems or conditions like liver disease, diabetes, or kidney failure, wear protective shoes and clothes when in or near coastal waters. When consuming seafood, cook it thoroughly before eating and wash your hands thoroughly after handling raw seafood. And if you're at high risk, consider wearing gloves. Now, you might be thinking, why is this happening now? Haven't we always had bacteria in the water? Well, it's true that bacteria have always been present in coastal waters, but the increase in cases is a cause for concern. And it's not just Louisiana. Other states along the Gulf Coast, such as Florida, Alabama, and Mississippi, have also reported cases of Vibrio vulnificus. In fact, according to the Centers for Disease Control and Prevention, several states along the East Coast, including Connecticut, Maryland, New Jersey, New York, and North Carolina, have also reported evidence of this bacteria. Now, you might be thinking, what does this mean for the future? Well, it's a bit of a mixed bag. On the one hand, we need to take these cases seriously and raise awareness about the risks. On the other hand, we also need to remember that bacteria have always been a part of our environment, and we've learned to live with them. But the increase in cases does suggest that we need to be more vigilant and take steps to protect ourselves and our loved ones. So what's the takeaway? Well, it's all about being informed and taking simple precautions to protect ourselves from this flesh-eating bacteria. And remember, it's not just about the bacteria. It's about the bigger picture of public health and safety. So, stay informed, stay safe, and let's keep the conversation going.